Welcome, everyone. Thank you for joining us for Reducing Breast Cancer Recurrence with Dr. Michelle Smekens from Cancer Treatment Centers of America. I want to welcome and let you know that the program this evening will be recorded. If you have any questions, please submit them through the chat, or there will be an opportunity at the end where you can unmute yourself to ask questions directly. And so without further ado, I want to welcome and introduce you to Tom, who can tell you a little bit more about Cancer Treatment Centers of America, and introduce Dr. Smekens.
Thank you so much. And I want to personally thank, on behalf of CTCA, Cancer Wellness Center, for this opportunity to speak with you about breast cancer recurrence reduction by diet and lifestyle changes. Just a little bit of background, if you're not familiar with us, Cancer Treatment Centers of America, we're a 5-hospital network around the United States. And as you may know, our hospital in this area is in Zion, right on the border of Wisconsin and Illinois. We also have a couple of outpatient care centers. We have one in Gurnee, and then there's one in downtown Chicago as well. And our sort of approach to treating cancer is integrative care. And treating the whole person. And so this is a great way to kind of introduce that to you. And this presentation Michelle's given before, and this is just a really great fact-driven presentation. So with that, I'm going to introduce you to Dr. Smekens, and thank you for being here.
Thanks so much for that nice introduction. So I have been with CTCA for about 10 and a half years, and nearly all of that time I've been working in the breast clinic. So the majority of my patients have breast cancer or are breast cancer survivors, over 80% of them. So this is an area of passion for me, and I really look forward to the next half an hour to an hour discussing with you some of the literature and research updates on things that are most impactful that you can do. And what I really like about this lecture and a lot of the work that I do is very empowering. These are things that you can do for yourself. It's not something that a doctor has to administer to you or something that has to be given. These are things that you can absolutely earn in terms of your overall health and helping to stack the deck a little bit in terms of diet and lifestyle to reduce breast cancer recurrence. So let's get into the facts, ladies. As we said, I definitely welcome questions. I'm a very casual, laid-back presenter, so there'll be different opportunities to put it into the chat, and I want people to feel comfortable that this is an informal space that we can have discussions about things that you have questions about, or nutrients or supplements you might have questions about too. Okay, so here's a disclaimer a little bit, which you probably see in a lot of these types of lectures, which is that you are not patients under my care. So a lot of this is just general information for educational purposes. If you have anything that you want to take or change about your healthcare or your exercise regime, please consult with your physicians and clinicians and dietitians. This is not a substitution for that type of healthcare provider, okay? Okay, so here's what we're going to talk about tonight. We're going to talk about different phytochemicals that come from plants. We're also going to talk about vitamins. We're going to talk about minerals. We're going to talk about dietary and supplemental intake of cancer-fighting foods and nutrients. We're going to talk about interpreting the research, so help you understand a little bit. Sometimes you might catch something in a blog or in a book or in a headline. I want to help you kind of break it down and understand like what's called translational. So like, how does this make sense for me? So we're going to talk about that. And then we're also going to always underscore and emphasize safety, which is avoiding drug, nutrient, and herb-drug interaction. So a lot of my office visit time spent with patients, I'm going through their different supplements that they're taking and making sure that everything is compatible and safe with their conventional treatments. Okay, so we're going to use we're all on Zoom these days with the COVID world. So we're going to use this nice little interactive tool here, and I'm going to launch the poll. And I want to just know a little bit about you. And I want to know that way when we're chatting who I'm speaking with, and then I can orient a little bit more specifically some of the topics to the patients that I was talking about.
Can I ask a question about that?
Yeah.
What's the difference between I am in remission and I'm no longer have breast cancer?
I mean, I think that those are it's a pretty interchangeable category depending on where somebody is in terms of their treatment. So, for example, somebody might be in the midst of radiation completing treatment, so they might not consider themselves in remission because they're finalizing still definitive early stage treatment. But I know what you're saying. Like that definitely is a continuum of a period of time. Okay, so it looks like, can you guys all see this poll too, or am I just seeing this?
Just you, I think. Yes.
Okay, so let me give you the feedback a little bit about the poll. So it looks like about a quarter of patients are currently undergoing treatment, okay? And then the majority of people on the call are either in remission or no longer have breast cancer, so maybe finishing up that, like we're talking about with the situation with adjuvant radiation. And then just under 10% of people on the call have metastatic disease. Well, I have some good news for the patients on the call who have metastatic breast cancer, because a lot of these things can also apply to you, even though we're talking about reducing recurrence. A lot of these same patterns have been associated with improving overall survival. For example, we'll talk about this, but like fish intake or vegetable intake, less alcohol, those things have also been associated with increasing overall survival, not just reducing recurrence risk. So a lot of what we're chatting about today will also be useful and applicable to you as well. And also, as many of you already know, breast cancer is absolutely in most situations now a chronic disease. So I have many patients who, in the 10.5 years I've been in this clinic, have had metastatic disease when I met them and still have metastatic disease and are with us. So absolutely this kind of a long-term span in terms of treatment and having them adjust their lifestyle and diet based on their active treatment too. Okay, thank you everyone for taking the poll. Looks like a lot of people participated. Oh, and I don't think we had any caregivers or family members. So looks like everybody here, this applies to your own health. Okay, so first thing is I want to do a little introduction about what is naturopathic medicine, because maybe not everyone in our audience has seen a naturopathic physician before, so this might be kind of a new thing, a little bit, different to understand what exactly is the credentials and kind of specialty and expertise. Okay, so if you see a licensed naturopathic physician, they had to attend a 4-year program after college. So they had their college coursework, their prereqs, and then went to a 4-year integrative medical school. Okay, they have to be federally accredited in order to stand and sit for their boards afterwards. And then following that education, there are opportunities for residencies and specializations, much like you would see an MD or DO can kind of focus on an area of interest. For myself, of course, it was oncology. So I carry a FABNO, which means I had a specialty training and sat for boards in oncology, but there are other board certifications too. So say, for example, you might want a naturopathic physician for a child. You might want to look for somebody who has a pediatric specialty, or say you have somebody who has a complicated Hashimoto's case in their thyroid, then they might want to see somebody who has extra training and credentialing in endocrinology, for example. Okay. Okay, so here are big philosophy kind of cornerstones of naturopathic medicine. Healing power of nature. I don't know if you guys can see, I'll kind of flash you my office, but I have about 7 live plants here, all that can survive in low light conditions and live here in an office space that can often be dark. So I absolutely bring that into my own space here at the hospital. Identify and treat the cause. So say, for example, someone has a headache. That doesn't necessarily mean that someone has a deficiency in aspirin or acetaminophen. So a lot of times if I have a patient who has a headache, I'm trying to figure it out. Okay, do they get enough magnesium? Do they have food sensitivities or allergies? Is there a structural issue and I should refer them for a chiropractic adjustment? So those types of things, really kind of trying to get at the heart of the matter. Absolutely, first, do no harm. So safety is huge for me. If I don't have evidence of safe combination using natural agents with medications, I do not use them. So some people would consider this to be kind of more conservative, but I absolutely believe, especially in the oncology space, it's better to be safe if you're not sure or there's some kind of debate about things, and I'll give you examples of that tonight. I really believe in docere, which is doctor is teacher. I think about when I'm working with patients or even talking to all of you tonight, like a lot of my job is to be a teacher here and to disseminate information and help understand the research and apply it to yourselves. And then a whole person approach. So sometimes when I'm meeting with a patient, they're like, can you give me like one more supplement for hot flashes? And I'm like, wait a second, like, let's slow down. You've been having a lot of hot flashes since you had that stressful situation with your sister-in-law. Like, maybe the issue is not one more supplement. Maybe the issue is like coping and, you know, skills to have to do with some of the psychosocial things that are going a little bit on in your life too. And then a lot of what this talk is about and other lectures that I give is prevention. Like, what are the things that we can do to prevent different diseases, and what do we know, like, and what do we not know? So what things can we harness and execute on to have the best efficacy in terms of prevention of disease as well? Okay, so so we talked a little about naturopathic medicine, but now let's pull that into integrative medicine, okay? So it used to be that a lot of times would say, I see an alternative medicine doctor, or I'm interested in alternative medicine. Well, the kind of medicine that I'm doing is what we consider integrative medicine, because it's taking the best of both worlds. My patients absolutely are having surgery, radiation, chemotherapy, immunotherapy, targeted therapy, endocrine therapies, hormonal therapies, everything. So it's not to say that this is like one or the other. As a matter of fact, people all the time come to me wanting to do only natural treatments for their cancer, and I have to have this kind of sit down and talk to them a little bit about what the limitations are of natural medicine and why that wouldn't necessarily be appropriate for their given situation. And most of the times it's not. There are a few exceptions to that, but most of the time it's not appropriate to do that. So when people use the word alternative, it's kind of like, you know, in the past tense, like that's used to be like a concept that a lot of people would use to describe this type of medicine. And I really prefer the word integrative, because it means a team approach, like taking the collaboration of the different providers together for the best interest of the patients. And absolutely, in all of this, using the least invasive, most effective treatments. So, for example, if I think a dietary intervention will help somebody who doesn't have enough omega-3, a type of, like, people think of fish oil or flaxseed, we'll talk about those. I always tried to have people do them dietarily first, but if someone says to me, look, Shelly, I don't like fish, I don't like shellfish, I'm not eating walnuts, flax, chia seeds, it's not happening, then I will sometimes utilize a supplement. So it's not to say that we don't use them, but I try to do the least invasive thing first to minimize pill volume and also to make things as easy as possible for patients, depending on the scenario. Okay, so this was a good segue talking into supplements and supplement quality. Okay, so basically, this is how it goes. For supplements, the DSHEA Act was a federal law that was passed that regulates supplements. And the problem is that a manufacturer can't make a claim on the bottle saying, you know, vitamin A used to treat breast cancer, so they can't do that. But what they can say is on the label, this contains vitamin A, 25,000 IUs. Do you know if it contains 25,000 IUs? You don't, unless you're buying from a reputable brand or a brand that guarantees by doing third-party testing. So I always tell patients when I'm training them to relabel and understand quality to make sure that it has some certification. USP is the most common, and again, this talk will be recorded and you guys can have all these notes, but there are different ways to look for that. But the most important thing with supplement quality is just making sure that what's on the label is actually what's inside the capsule. That's why I'm not a big fan of people ordering from, you know, Joe's Basement off of Amazon. Like, I'd rather have it be like a good supply chain. So it comes from the manufacturer or from an authorized retailer of the manufacturer, so that you are getting what you're getting. I actually had a scenario probably a number of years ago now where I had a patient whose white blood cell count really, really improved with a specific mushroom extract. And then she refilled it, ordered it online, and noticed that the color was off and the smell was off. And then we took it and sent it to the lab, and it actually was not the same mushroom. Someone had actually kind of like basically photocopied and fraudulently made a label of the same supplement that she was taking. So, because it's kind of a little bit of a scary world out there if you're buying from an area that you don't know. So I do tell people to, check what's on the label, make sure you're buying from a good company, check for certification, and be careful to make sure that everything is sealed and not expired. So check expiration dates as well. Okay, so why would we use dietary supplements? Like, what are the scenarios that we do? Sometimes we do it to support vitality. So there's some situations where, let me give you an example. Today I had a patient who was extremely fatigued, and we put her on B12, a sublingual form. She's doing much better. It really helps. So I checked her labs, saw it was low, repleted the B12. Patient's doing a lot better. Okay, so that's an example. We also might do it to support the immune system. I know a lot of people are talking about kind of the COVID, and there have been some studies published on vitamin D and zinc and melatonin. So like people are looking at immune support, both in the cancer realm, but also in the infectious disease realm. Sometimes we'll do it to help with healing. So pre and post surgically, they make different types of formulas that can help with major surgery. So I do use those types of drinks when people are going into a big surgery. And specifically, there are different types of supplements. You can get vitamins and minerals, which would kind of be like a multi, or you can get botanicals or herbs. Those are kind of the main categories that you would see. And I did mention the DSHEA Act a little bit. So that was the law that was passed. And I kind of gave you this spiel a little bit about just being careful about quality. So let's pull it back a little bit back into the cancer realm. So some people will say, oh, well, that's natural. Well, how can it be, powerful or effective? But look at how many different medications that we use that are derived from natural sources. So most people probably listening today have had aspirin at some point in their life. That actually comes from the willow bark. Codeine, which is used as a pain medication as well, is found in poppy seeds. And then look at some of these chemos, specifically paclitaxel is used a lot in the breast cancer realm, and that comes from Pacific U, but also topotecan, vinorelbine. There's other examples are also sourced from naturally occurring sources, from botanicals. That's how they're first discovered. Okay, and so these are those, remember I was talking about kind of certification? These are kind of those main certifying bodies that you should look for, that the supplement would have one of those on there. And we talked about authenticity, purity, potency. Let me go back to one more thing about also the having a supplement that's the right type too. So a great example with this audience is talking about black cohosh, which is a common herb that's used for hot flashes. But black cohosh has a little bit of problem in the commercial sphere, and that they're not always using the right form of it. So sometimes you'll have people using the leaf, and you're supposed to be using the root or the rhizome. So you come and run into some of those issues. And I've had, when I was like early in my career, and I'd be having somebody on black cohosh for hot flashes, and then they would come back to me and they would say, Shelly, that black cohosh should work really well for like about 2 or 3 months, and now it's not working anymore. And I made kind of like a rookie mistake, and I would right away like change what we were doing to help with the hot flashes. And then come to find out, a lot of times people were having those kind of relapses when they were switching brands. So it's like they'd be on a brand, it would be helping with their hot flash, and then they would run out of it back at home, and they were like, 6 states away, and then they would just buy whatever when they ran to Walmart and getting errands, which, they weren't thinking. I would think the same thing if I didn't know that this was such an issue with black cohosh specifically. And then now that I've been in practice a lot longer, I've learned to find out. I'll ask people, okay, well, when did those hot flashes come back? And was it about the time that you ran out and switched to another brand? So now I kind of ask a lot of these kind of like leading questions, and it's really helped me honestly, like figure out sometimes if something stops working for joint pain or other symptoms where it was working for a time. A lot of times I'll do a little bit more digging and figure it out. This is a good link if you're kind of wondering just like what our baseline nutrient needs. So this, again, you'll have access to all this, but this is a good link to have. Okay, so we talked about a lot of things on here. Just to kind of a warning that in general, medications, including supplements, are not tested on pregnant or lactating women. Nobody wants to test pregnant or lactating women. It's kind of like this like encapsulated protected group that studies are hardly ever done on. So it's very hard to get safety data in pregnancy and a lot of things because it's just not well studied. And also, as I said, the top of the talk, be careful, please don't go rogue. I'm going to talk a lot about natural medicines, and it's my passion and I love it. But I don't want people going and, trying 7 or 8 new things and it's not compatible with your treatment. So, kind of always just run that by like a pharmacist or somebody kind of like in my realm that can do an interaction checker. Okay, so phytonutrients are different compounds that are sourced from plants. Okay, so when I'm using that word in this lecture, I just want you to like understand like what the source of that means. So it kind of drives me crazy when everybody in articles, like I'll pick up like a women's magazine and they're like antioxidants. And I'm just like, okay, there are other phytonutrients besides antioxidants. Antioxidants are wonderful. They scavenge free radicals. They help reduce aging speed. Like, I love them. I'm not saying I don't, but like there definitely needs to be something to be said that there's so many other phytonutrients. And when we're talking about breast cancer in particular, these polyphenolic phytochemicals are really the promising things in olive oil, isoflavones, like we'll talk about soy foods, flavonols found in grapes and tea and actually green tea, especially we'll talk about, and a little bit in chocolate too, but doesn't mean it can be the sugary chocolate. And we'll talk a little bit about alcohol as a risk factor for the breast cancer aspect too. But I just want you kind of as the audience to listen, and when you're reading magazines or literature, understanding when someone describes something that everything is the antioxidant. There's so many different phytonutrients, and just do like a little bit of groundwork. And there's some good books, actually. One book's under my computer, I'll show you at the end, that can help you understand some of these constituents if you're really interested and you want to learn more about their categorization. Okay, so here's kind of the heart of the talk. Here's what you tuned in to hear now that you're primed, okay? So here's the things that we have a good level of evidence to say will reduce the risk of getting breast cancer in the first place, okay? So breastfeeding, having a baby before the age of 30, getting your period a little bit later rather than a little earlier, exercising, especially when you're younger, staying away from tobacco and alcohol, limiting exposure to hormones. So that could be hormone replacement therapy, that could be progestin-containing birth control. And frankly, I gotta say, I do have a lot of patients also now who have had infertility treatments or many rounds of infertility treatments that have had a lot of exposure as well to exogenous hormones because of doing some conception or fertility work. Dietarily, and again, we're going to talk about two things. One is primary prevention, which is getting breast cancer in the first place. And the other thing is secondary prevention, which is preventing breast cancer from recurring, okay? And then the third group, which I talked about, was like kind of metastatic, improving overall survival. So all those things we're going to talk about at various points in the slide. This slide is most heavily weighted on primary prevention, so getting it in the first place, okay? But a lot of the things still apply to the other, and we will chat about that. Maintaining a healthy weight. This is especially more so in the postmenopausal population. Weight is not as much of a factor, honestly, in premenopausal situation than in postmenopausal. For diet, minimizing animal fat, having a diet high in fiber with lots of fruits and veggies, preferring fish as a source of animal protein. And I want to give a plug right now that Cancer Wellness Center does have a program, Weight Loss for Wellness. It's a 10-week program. I've heard wonderful things about it. So if you're interested, you can put into the chat box, and you can also give them a call. I believe the next enrollment will start in the beginning of 2021. So that's a 10-week program. And I think with COVID and all of us maybe having a little bit of trouble staying on track with our fitness goals this year because of, pandemic and global things outside our control, what a great resource to have with the Cancer Wellness Center to be able to do that exercise program is fantastic. Okay, so I mentioned this a little bit, but especially postmenopausally, that is where excess weight increases breast cancer risk, and especially more so with estrogen positive breast cancer, okay? So sometimes I'll have a patient with me like super lean, triple negative breast cancer, 32 years old, and they'll say to me, but I'm not overweight. Why did I get breast cancer? And I you kind of pause, and you always want to be like very comforting and nurturing. But I also say, well, that's not really what the research shows. And I say that to them. I say, look, the research doesn't show that if you're in your early 30s and lean, that you're at increased risk for triple negative breast cancer. Like that correlation has not been made that strongly. I said, really, the correlation is much more strongly for postmenopausal estrogen-driven types of breast cancers, and kind of because a lot of patients out there just are not really aware of that. And there's kind of a misconception that it's all the same for all ages, all biotypes of breast cancer, and that's not the case. Alcohol is a breast carcinogen. One of the reasons it does that is because it increases aromatase activity. Some of you may be taking aromatase inhibitors, right? That lowers estrogen that's made in the body. Alcohol can actually increase activity of that enzyme. That's one of the reasons that it may be increasing breast cancer risk. Also, it diminishes folate, which is a really important B vitamin. Part of the reason is because of its diuretic effect. So especially in teen and early adult years when the breasts are very metabolic, having that alcohol exposure, which kind of coincides when a lot of people are drinking, you know, in the kind of the college years. So when I'm counseling young women, I'm a lot of times making sure if they're going to be drinking alcohol that we're making sure you have adequate folate intake and, you know, other things that can help mitigate risk and doing things. But I'm absolutely explaining to them like why this might be a risk factor, especially if they have a family history or a genetic mutation. And I do end up getting patients with, you know, BRCA mutations or other things who are in their 20s and getting that information. As we said, limit intake of animal fats, and then high fiber diet, but high fiber doesn't have to be that high. Like there was one study in particular that I pull out, and when I'm looking at the literature in general, I'm looking for like compiling. So like what we call meta-analysis. We take many different studies together and you look to see what those say as a totality. But I just want to point out that there have been some studies that looked to see that even some fiber can be really beneficial in terms of overall survival from breast cancer. So when I have a patient and they're doing a keto diet, which has been really trendy lately, frankly, I'm a little concerned because I'm doing their diet diary with them. And I'm like, you're probably getting like 2 grams of fiber a day based on the recall that you just gave me because you're living on like, you know, meat and cheese and eggs and mayonnaise. So, you know, be kind of conscious of that. If you have friends that are kind of jumping onto some of these fad diets that are extremely low carb, they may not be getting adequate dietary fiber. And an easy way to modify that on a keto diet would be to eat like low carbohydrate vegetables, you know, the cauliflowers and cucumbers and things like that. So a lot of times I'm counseling patients when they're kind of sticking to something like that. Come on, we can at least modify this to make this a little bit healthier for you. Okay, so this has been like a big deal in the last like couple of years is long overnight fasting. People are looking at something called insulin growth factor 1, IGF-1, and they're looking at hemoglobin A1C, which is an average. So hemoglobin A1C is an average of your blood sugars over a period of time. IGF-1 is stimulated by insulin secretion when you have kind of higher blood sugar. And what we're finding is some really intriguing things in breast cancer survivors that if we can lower IGF-1 and we can influence hemoglobin A1C, we could potentially reduce recurrence. What that means, practically speaking, if you look at this particular paper that came out of the Well trial, that was a kind of a big long-term trial, is that they did 13 hours between dinner and breakfast. They had a 36% reduction in recurrence compared to those who had less than 13 hours. So those would be like the nighttime snackers, like the popcorn eaters, the chips on the couch before bed. So a lot of times I'm counseling patients, okay, I know it's very tempting, but you know, you got to get yourself out of the living room, away from the kitchen, you know, where the temptations might be, where the family or other people might be having the munchies, because of that timing and duration could be really important for you. And if you think about it, I give this example for people to kind of help motivate them is that, you know, aromatase inhibitors or tamoxifen, you know, these SERMs, these other treatments that you're taking, they can potentially have side effects. This is something that may be a little tough to do to cut out the nighttime munchies, but if it could potentially reduce recurrence without having all additional side effects, like it's something you should definitely give it a try. And then, I'll say too, for the patients that are listening that are the metastatic, there was a paper that came out earlier this year too, looking at doing intermittent fasting to improve response to CDK4/6 inhibitors. So that's like the Ibrance, Verzenio world. So there is some application to this also for metastatic disease as well, okay? And I know we're also using sometimes CDK4/6 inhibitors adjuvantly in trial situations. So I do have some patients on trials as well who are curative intent on those medications as well. Okay, so it's hard for me to pick because there's so many things I love in this realm. We're talking about those phytonutrients, but I tried to pick some of the top things in terms of good quality research for potentially reducing recurrence, and things that are practical too, things that we can practically utilize. So we're going to talk about green tea. We're going to talk about mushrooms, particularly those that are rich in beta-glucans. We're going to talk about sulforaphanes and other compounds in cruciferous vegetables like calcium D-glucarate, indole-3-carbinol, diindolylmethane. Those are all found in cruciferous veggies. We're going to talk about flax seeds, and we're going to talk about olive oil. Okay, so I have a couple of pages of studies here on green tea and breast cancer, okay? So some of these studies, like this kind of the Shanghai breast cancer study, kind of looked at like higher consumption, drinking 3 cups or more per day, had 25% less recurrence, specifically triple negative. This is interesting. I bring up the triple negative because we used to think like 10, 15 years ago, oh, most of the benefits for green tea are helping with estrogen clearance. But that's really not the case because triple negative breast cancer survivors also seem to really benefit from the green tea. And there have been some studies, what we call neoadjuvant, like ahead of surgery, where they've given green tea extract to triple negative breast cancer patients and seen some markers change in terms of aggressiveness beneficially with green tea. So I am not at all labeling green tea specific to estrogen any longer, and nobody should really, even though you still sometimes see that in articles. They should kind of cut that relationship and say that no, specifically this is a breast cancer benefit aside from that biotype. There's also, I mentioned the supplement aspect too, because some people do not enjoy green tea or it gives them GERD and they do okay with the extract. So, but the extract has some potential drug interaction, so some scenarios where you wouldn't want to use it. Okay, then I added to this talk some of the more recent big, remember I talked about meta-analysis, as we take all the studies and we put them together so that we can make like kind of intelligent conclusions. It's one thing to see something, you see like, oh, that's interesting. Let's learn more about that. And then you see it again, you're like, oh, like there really might be something here to that. But then when you have a meta-analysis and you have like, 12 studies or 20 studies saying the same thing, then you have more confidence that that is a good recommendation, okay? So I'm going to go through some of those. So in 2018, there was a review of meta-analysis, and they looked at green tea. They said it is really good at preventing getting breast cancer. Remember, primary prevention is getting it in the first place, but it might be even better at preventing recurrence, which is so applicable to this talk and the audience of the ladies that we have here, and potentially gentlemen, because it might be even more powerful potentially in reducing recurrence. In the 2019 review, they looked at basically, that was more like primary prevention, and said it was about 17%. Some people might say, oh, okay, well, 17%, that's not a huge number. But if you think again, in terms of side effects, like it's not that hard to drink green tea. You can have it iced, you can have it cold, you can have it decaffeinated. The catechins that are anti-cancer in green tea do not need caffeine. They do not need caffeine. You can still get those catechins. Like in the trials where they've done it for like, lymphomas and CLL, like they were using decaffeinated products as well, not just in breast cancer. And then I wanted to include this 2019 study too. It was a big study, 5 years. And again, this particular one was looking at Chinese population, so that kind of genetic makeup. But they looked at a hazard ratio, which is kind of like reducing risk, okay, hazard ratio. And it was about cut in half among green tea drinkers. And that was after they had breast cancer, right? Again, reducing recurrence. But they did not see it like with other tea types, like oolong or black tea. And I gotta say, I was kind of a little bit disappointed because I love a good chai, but after that, I was just like, the chai is just not there, right? In terms of the breast cancer risk reduction, it has to be the green. And if you're not crazy about green, maybe like green with white tea or mix it, with a little bit of lemon. So it might be kind of making it more palatable. Some people love green tea. Other people feel like it tastes like the front lawn. So there's definitely like a variation in terms of palate there. And I work with patients trying to make things like more tasty, mix it with blueberries, like different ways to make it taste better if they don't like it. Okay, so green tea, we're going to shift into mushrooms. This is something I eat every day, honestly, just because I work in this sphere and I'm kind of obsessed with them. So dietary mushroom has been associated with low risk of breast cancer. Mushrooms are a great source of selenium. They're actually a pretty good protein source for like a vegan or a plant-based diet. Mushrooms are very high in something called beta-glucan, which has an effect on the immune system, specifically something called a natural killer cell, which is a type of immune cell that kind of is like a surveillance, like going around looking for abnormal activity. Applicable to kind of what we're talking about in the world right now, NK cells are very good in terms of like a viral situation too. So people a lot of times will eat mushrooms traditionally in terms of like immune support during cold and flu season. Okay. There have been many studies combining different Asian mushroom extracts with chemotherapy and have shown that they can reduce the side effects. There are also some studies showing improving overall survival. Not a lot of things have that level of evidence like mushroom extracts do. Specifically, I like this study because Coriolis, very easy to take, very benign. I've had only a handful of people in a decade have any allergy issues with Coriolis. Reduced 5-year mortality, and this was not just looking at breast cancer, other cancer types too, by about 9%. Think about that. Like, you might have to add on another chemo or another treatment that would have more side effects. What is the side effect of Coriolis? Really pretty much nothing. Can maybe slightly lower blood sugar in some people, but for the most part, people don't even notice they're taking it. There are studies specifically in breast cancer with Coriolis looking at that. Looked at moderate doses and high doses and low doses. Maitake is another mushroom I use a lot because of enough studies done in breast cancer. What's interesting is that low doses don't seem to work really all that well, and super high doses, like kind of beyond what you would even typically see, didn't see. It was almost like a Goldilocks effect, where it was like moderate to moderate high worked the best in terms of stimulating the immune system. Very low or like very extreme high did not. So we have a Goldilocks phenomenon with the mushroom extracts. I just kind of gave, again, remember review is kind of a combination of studies, and I just wanted to point out the mushrooms that have the most data in breast cancer, because sometimes I'll have people come in and like they're taking a species and I'm like, yeah, lion's mane's great for cognition and it's good for anxiety, but like you're specifically taking it for the breast cancer benefit and like the data is just not there. So with species specific, just make sure that you're achieving the goal that you're after. I wanted to include a study looking at dietary intake because some of the other ones were based on supplements. This was a more recent study, and they looked specifically at eating mushrooms, like dried mushrooms, fresh mushrooms, and also found that you got a risk reduction. So it's not that it just has to be a supplement. However, the Asian mushrooms are higher in beta glucan, and that is why we continuously keep going to them over like the Bellas or like the white button. It's just because you get a bigger concentration of the beta glucan in there. Okay, so that's the reason you'll see people do that. Okay, from mushrooms, we're going to go to cruciferous veggies. So if anyone is having Brussels sprouts or broccoli coming up here, our little Thanksgiving and COVID hideaway. So cruciferous vegetables, broccoli, cauliflower, kale, cabbage, Brussels sprouts. One of the reasons we think that they might have a prevention aspect in terms of breast cancer and breast cancer recurrence is because they're involved in metabolism of estrogens in the liver, okay, in the liver. So I talked about this briefly, but we have diindolylmethane, calcium D-glucarate, indole-3-carbinol, sulforaphane. All of these different compounds that are found in cruciferous vegetables have been independently or in combination studied in terms of having kind of preventative benefit in cancer. Interestingly enough, sulforaphane they also are looking at for preventing skin cancer. It's a clinical trial showing benefit in schizophrenia. So it's not really good studies with cruciferous vegetables and colorectal cancer. So it's not to say it's just specific only to estrogen clearance, but it's one of the mechanisms by which we think it's helpful. But also it's helpful in these other cancer types. So we're not going to say it's only estrogen is the whole story. Go back to the WELL trial, which we mentioned a lot because it is a large study looking at breast cancer survivors. And they looked at women who were taking tamoxifen and what they're eating in terms of their vegetables and what type of vegetables and how much they're eating. And in the women who ate the most cruciferous vegetables, they had about half the recurrence rate that those are eating the fewest servings. So I know 3 or more servings might sound like a lot to some people, but that might be like you have a coleslaw, like a decent portion of coleslaw. That could be 2 servings. And then maybe you have broccoli for dinner. So sometimes with this portion, it might just mean like having a big salad and like putting lots of like kale mixed in with the other lettuces in there. So when I'm working with patients, a lot of times I'm giving them ideas or giving them soup recipes, ways that we can get cruciferous vegetable intake up so that you're getting more than 1 portion at a time. Okay, so we talked about veggies, we talked about tea. Now let's jump over and talk about seeds a little bit, okay? So I love ground flax seeds because they are an amazing source of fiber. They have the lignin in there, which we think has the most potential anti-cancer effect. There is some potential benefit on hot flashes, some studies that show that. They've looked at patterns of flax consumption and saw that highest groups of flax consumers had the lowest risk of breast cancer compared to other groups. I also like it because it's a great source of omega-3 for inflammation, and so many of my patients are suffering from symptoms of inflammation, joint pain, aches, chronic pains, those kinds of things. So I love utilizing flax seeds and flaxseed oil to help with inflammation and get these other fringe benefits as well. Okay, and then we're going to talk a little bit about soy because there's a lot of like kind of misinformation and old information out there about soy. People used to say, no soy for breast cancer survivors. It's estrogenic. Oh my gosh, freak out, and that was, and the reason that people said that, okay, to be fair, was because they looked at in like a petri dish or an animal study and they said, wow, like it does have properties that activate on the estrogen receptor. Like we should pay attention to that. But fast forward 2 decades of research, and what we now know is that phytoestrogens in soy actually kind of almost have like a blockade effect. So they will activate on the receptor very, very weakly, and that keeps a more potent estrogen like estradiol from locking onto the receptor. So it actually has kind of like a protective effect that way. What I don't do, though, is I don't say it's okay for my patients to take soy isoflavone supplements like genistein or things like that, because those have not been adequately studied in breast cancer survivors. So I'm not even crazy about my patients having like soy protein isolate, like which is what is found in a lot of like soy protein powders, because that also has not really been fully vetted. What they've looked at for having benefit is the food, is eating tofu, eating edamame, and eating tempeh, soy milk. They looked at like whole food sources of soy, and that has been studied well enough to this point that you should feel very comfortable. Like some of the biggest agencies, the American Institute for Cancer Research and then like the World Cancer Research Fund, like those groups who have like done a lot of the kind of like policy and decision making have looked at all that is the foods. Okay, so foods. And I just included some recent studies. Okay, so you have these, and again, you can have all the notes, and we're in presenter view so that we can see the slide clearly, but I put all the references into the notes section. So if you want any of the references, they're all contained within this lecture. Okay. So in a recent large review and meta-analysis, putting all the studies together, they looked at women who consumed soy after a breast cancer diagnosis and saw a 20% improvement in overall survival. And specifically 17% of that was breast cancer specific. So for a long time, people were saying, oh, well, there's improved survival among the soy consumers, but it's only because they're not eating cheeseburgers and they're eating soy and healthy foods. But this specifically pulled out breast cancer mortality and not just cardiovascular health, okay? So you should feel confident that it's not just solely isolated to the cardiovascular benefit. Specifically, soy consumption has also been shown to help with some of the menopausal symptoms, which is really plagues a lot of my patients. Hot flashes, night sweats. They've even looked at soy consumption and bone density. There's been some kind of interesting research on looking at that more recently. I kind of put this in there, and you can always like chat a little bit more with Lori, who is the dietitian as well here on staff. But there's mixed data a little bit on dairy that you may have caught wind of a big study that came out earlier this year showing that maybe milk was not the best thing in terms of cancer prevention. And because of that, that's what I tell patients when I'm discussing them. They've asked me questions about dairy, is I'm like, look, like we really don't know. There's some things that show that in premenopausal women, it might be beneficial, but then there's like more recent study that says like it might not be so good, especially in postmenopausal women. So with that kind of question hanging over the dairy, a lot of times, a lot of my patients are choosing to use plant milks. And so a lot of them are doing oat or soy or almond or other plant milks as we kind of sort out and figure out what exactly is going on there dietarily. Okay, so I just plowed through a lot. I know I probably should have paused to ask for questions at one point or time, but we're almost to the end. and we'll lots of time, and I'll stay to answer all the questions. So let me get through the last couple of sections, and then we will take on lots of questions and chat until everybody has everything answered. So I should have stopped, but I get excited and I just kept going. Okay, so vitamin D. Okay, all my patients, it's non-negotiable, have to check the vitamin D. Okay, the people who tell me, oh, I'm a sun worshiper, my vitamin D is going to be great, and theirs comes back at 17, so I don't trust it anymore. I have to have a lab, like, show me the proof. Okay. 2019 meta-analysis, a 6% decrease in breast cancer risk. Okay, so this is getting breast cancer in the first place for every 5-point increase. But what's the most important thing on that bullet point? It's not that. The most important thing is that intake of 400 IUs a day only reduced risk by 3%. Because remember, hazard risk 0.97 means 3% less risk. Okay, but that's like nothing. Why is that important? Why did I put that in this talk? Because 400 IUs is the typical dose of vitamin D in a multi. It's just not adequate. It just does not reach the threshold for breast cancer prevention. And that is why we need a lab. And that's why we need to be more sufficiently checking and monitoring vitamin D, especially in this part of the world where we don't have a lot of people working outside 10 hours a day in the sunshine, and we're far from the equator. Okay. 2020 study, this is fresh off the press, okay, just this year. People among patients who have breast cancer who are ER positive, kind of early stage, 1 to stage 3. Again, if the vitamin D was more adequate, they had lower recurrence. This is exactly the theme of the talk right now, is like, we need to be monitoring vitamin D levels in breast cancer survivors to stack the deck. 13%, what is the side effect of vitamin D? A little happier, a little better bone health. Too much vitamin D is not good, but if you're appropriately supplementing vitamin D, you should not have side effects to get that benefit of low recurrence. If anything, you should feel better, okay? But this I want to point out, because I have people who come in sometimes and their vitamin D is 250, or it's so high it's undetectable on the lab. That happens too. I tell them, either you can have too much of a good thing, just like most things in life and most things in nature and the body. If you don't have, in this 2019 study, if you didn't have adequate vitamin D, you had, like, the hazard ratio is bad, right? You don't want to be above 1 on this. You have a 1.63 hazard ratio if you were too low. But if you were too high, and I believe in this study it was over 120, but I can check that. But that was too high, wasn't good either. It was 1.37. So remember how we had the Goldilocks phenomenon with the mushroom extracts? We also have that in vitamin D, okay? So again, this points to being responsible in terms of doing a lab and adequately dosing. We can talk about at the end of the lecture, but there are some range of vitamin D that kind of fits the general population without testing in situations where you absolutely cannot get a lab. But there are ranges where I will not go below or above because it's either ineffective or because it could potentially become too much. Okay, so exercise, and this is, I talk a lot about this. So type of exercise, if you look at exercise after a breast cancer diagnosis, it appears to be that the aerobic exercisers have the most benefit in terms of reducing risk of death from breast cancer and also reducing recurrence, okay? So if you're looking strictly and your goal is reducing recurrence, you should be looking at aerobic exercise programs, okay? If your goal is that you have terrible sleep and horrible hot flashes and you're about to lose your darn mind because of the stress of everything going on in 2020 in the world, then you should look for things like yoga, things that are kind of mind-body exercises, things that are slower, gentler, relaxing, because the research is really solid for yoga helping mitigate side effects for breast cancer survivors. So when I'm working with patients and individualizing kind of like exercise goals, I'm listening to them and saying, okay, well, what are your goals? Okay, your goal is bone density. Okay, well, then you should be doing weight-bearing exercise 2 to 3 times a week for X number of minutes. And, oh, it's your femur? Okay, well, then you should be doing squats and this and that. So individualizing exercise program for a breast cancer survivor, it's not the same thing for all people because my patient who's extremely stressed out and anxious is not going to get the same recommendation as my patient who's only looking at reducing recurrence because they're at high risk of recurrence, okay? So it'll be like 2 different programs. Okay, so here I just put down, again, pulling in some of the research so that you have the numbers. If you look at number of minutes, okay, specifically in postmenopausal women, Moderate to vigorous exercise. So the moderate would be considered like 3 miles per hour on the treadmill. Okay. And moderate to vigorous would be like 3 to like 4.5, 5, depending on the study. And you need between 150 and 225 minutes per week. Most of the studies don't say, okay, well, it has to be 30 minutes today, 40 minutes today. They look at kind of averages in the group. Then I pulled out the Marie study, which was recently published in Germany, and specifically looked at breast cancer patients, how they exercised, who lived, who recurred, and they found that if people were exercising, they were half as likely to die from breast cancer over the course of the study. And specifically, it was tied to the breast cancer. So people always say, well, it's because it makes your heart healthy, kind of going back to the example that we went to earlier a little bit, talking about heart health being improved. But specifically, they did look at breast cancer mortality and show that was reduced as well. And they looked, in the Marie study, they looked at even walking. So like not even doing like aerobic moderate, but just like people who walk briskly 3 to 5 hours a week. And so it showed in this study as well that you could have some benefits in terms of reducing recurrence. And then I tell patients kind of a goal, if you're going to be doing walking for a whole hour, which is a long time, it's a long walk, make sure you're at least 2 to 2.9 miles per hour for that walk in order to get the aerobic benefits to see this. Now I want to say, and I don't know if I put in the next slide or not. Oh, I did. Okay, so I'm going to talk about this and then I'm going to talk about the bias. Okay, so other studies I included in here is the Weiser study. They found, they were specifically looking at lymphedema, and they found exercise like so-so for lymphedema, but they found that if people exercise in group settings, so they kind of had more controlled environment with an instructor, they got better results. And I'll say that is true in general when I'm looking at all these studies, not just for breast cancer, but just cancer in general studies for improving side effects or reducing recurrence. It does seem to be that like participating in group exercise like has a added benefit. And then someone might ask, like there's a lung cancer study like this. Someone might ask, well, is it the exercise that helped the lung cancer patient, or was it like the social aspect of exercising in a group? And is that why they did better in the group setting than at home? And I think it could be. I think it could be that you get a lot of benefit going to a group class, the social aspect and the physical exercise of it. Okay, so I do think that there's a plug there. We're all stuck at home, you know, doing the virtual thing. There might be something to be said for signing up for some of the exercise programs as best we can. Of course, Cancer Wellness Center has it as well. So I want to also point out this 2018 study that looked at women, because sometimes I'll talk to patients and they'll say, well, I'm not ready to exercise because I'm going through chemo or I'm doing Herceptin and I'm doing Herceptin for a whole year and I don't feel like exercising. When I'm done, I'll do it. But I want to point out this study that showed that when patients started exercising during treatment still, when they had their adjuvant treatment going on, they did much better in terms of fatigue, in terms of depression, in terms of bone health and recovery, muscle strength. So it's kind of a little plug for saying, like, maybe not put off that day of starting exercising. Maybe do it while you're still, you know, finishing up adjuvant treatment if that's the phase that you're in. And I just kind of spilled out all this glorious information about exercise and breast cancer, but I want to always check ourselves, right? Because we don't want to be like kind of blinders on bias when we're reading the research. And there was a Cochrane review that came out earlier, and they said, you know, all this exercise is kind of hard to blind. You know, it's hard for someone to say, oh, are you or are you not exercising? Like the person who's randomized to the group to get exercise knows they're exercising. So their kind of argument is that like maybe these studies are not quite as good as they seem because we can't have a true blinding effect when you're doing any type of exercise study. So I'll just kind of give that in there too. It's true. Like, you know, there might be some placebo effect or social effect of being in a group exercise, but I'd rather have my patient have the placebo effect, have the social effect, and get the benefits than not get them. That's my view about it. Even if there is some elements of there, I still want people to have that joy and that enjoyment if that's there. Okay, so we're going to talk a little bit about sleep because it's important. I have a lot of patients that are like night shift nurses, night shift workers. Night shift workers has been associated in a number of different studies with increasing breast cancer compared to day shift workers. People have speculated why that might be. It could be low levels of melatonin that you don't get when you're working the night shift. It seems to specifically be in people who say, I'm a morning person, but I'm working the night shift and it's like counter to my circadian rhythm. So people who are night owls working the night shift seem to do okay. Like they're okay with it. They don't seem to have as many health adverse effects as people who are really struggling against their own natural circadian rhythm. And I just want to point out that like even a tiny amount of light can decrease melatonin production in your pineal gland in your brain. And if you can see your fingers, hold your fingers out in your bedroom tonight. And if you can see your fingers in your bedroom at night, then that's enough light that could disrupt melatonin synthesis. So I tell people, if you can get away with it, don't use a night light, use blackout curtains, different ways that you can increase your own endogenous production of melatonin. I'm a big believer in using the type of light bulbs that block out blue light next to your nightstand. So like though my light bulbs next to my bed are kind of get like an orangey yellow hue because they block out blue light. So I'm a big fan of that. And I want to point out specifically, there's been one study that looked at HER2 positive biotype of subtype of breast cancer and found that short sleepers seem to be particularly vulnerable to that type of breast cancer compared to other types. Not every study has shown that, but I thought that was very interesting to see in that one study that it was particularly powerful connection. Okay, Tom warned you that I would talk fast and go through a lot of material because, of course, this is my passion. So we have plenty of time for questions, and I will be here, and I'm excited to hear what you have to say and your feedback and your questions and your frustrations, and I'm ready.
I can go through some of the questions that came through the chat, Michelle, if you are ready. So the first sort of question is spirulina a good B12 supplement?
No. Spirulina is okay in terms of, I do think it can help with energy production. It is good at reducing fat soluble toxins. It does not have enough B12 by itself to adequately replete B12 deficiency. You would need to have B12.
Thank you. And then is there, for sort of on the same theme of supplements, is there a specific type of vitamin D you prefer?
I prefer people take vitamin D with some fat in a meal. So vitamin D is a fat-soluble vitamin, so you enhance absorption if you take it. Say for example, you had a meal that had some fat in it, like some almonds, like that would enhance absorption of the vitamin D. So I do prefer it that way. I also prefer the form vitamin D3, okay? So when you're looking at a label, D2 is the kind that like, yeah, you'll get your level up, but its ability, its staying power, its storage power is not as good. So if you want to get your vitamin D and maintain it, you want D3.
And is cod liver oil better than a vitamin D pill?
There's some vitamin D in cod liver oil. My clinical experience, it has not been enough to increase vitamin D levels enough, usually. There are a couple of situations where I've had patients taking a lot of cod liver oil and it has, but most of the time it has not been enough.
Okay, thank you. And then kind of staying on the topic of food and supplements, is there a particular brand of green tea that you work with that you like the most?
Yeah, I like Phytonutrients and I like Clear Labs. And the reason I like those two is because you get enough milligrams per capsule. Some of them I'll see is like 30 milligrams. Well, they're just like so small. So I tend to use the Vital one and Phytonutrients. I tend to use the Clear Labs a lot. The Vital is decaffeinated. It's only 2% caffeine, which is nice. But the Clear Labs too, I haven't had really much of an issue even with the caffeine small amount in the Clear one either.
Okay. And you mentioned mushrooms earlier in the talk. Is there a quantity that you would suggest people should eat per day to achieve the best anti-cancer purpose?
Yeah, so that's a good question. So there was one study that looked for every 2/3 ounce, specifically at breast, there was about you would get about 4 to 5% less recurrence. So I try to get in like 3 or 4 ounces a day because then you get up to like almost 20%, you get to like 16, 20% less recurrence. beyond that, it could be even more. It's just that people don't eat enough to even track at that level, right? So we don't even know what would happen if someone had more. So the studies can only do what's an average human consumption. So basically you might have a big portobello, or you might have like a mushroom soup. I honestly just keep them on hand and I add them into everything. Say I'm going to make like an omelet, I put mushrooms in it. Say I'm cooking a soup, I add mushrooms to it. I just add it to everything. And actually hot water extraction enhances the bioavailability. So like bioavailability is like how well we absorb things. Hot water extraction enhances that. So teas, broths, soups, sauces enhance absorption of the anti-cancer compounds in the mushroom.
And you mentioned Asian varieties. Where would somebody find those Asian varieties?
You know, a health food store would have it. Like I actually do see it. Like when I go to even like I've even seen it at Mariano's sometimes, you know, up here, I'm in the middle of nowhere and we even seem to have it. But health food stores would have it. Asian grocery stores would have it. Sometimes they're dried, sometimes they're fresh. I see it. There's a cute little mushroom farm. I know everyone's from all over, but like on the way to Lake Geneva off of Highway 50, if you guys are ever like on your little road trip somewhere, there's an adorable mushroom farm, and River Valley Ranch, and they make all kinds of really cool, Asian mushrooms too. But, you can also order them dried online, you know, so some people will do that as well. And, sometimes frozen, they'll have them frozen Asian mushrooms too.
Same on the food topic. Would you, is it okay to eat tofu and tempeh?
Yes.
Thank you. Should we be concerned if we're consuming non-GMO soy, and does it make a difference?
I prefer non-GMO soy just because it's one of those crops that has been adulterated a lot. And my issue with it is I'm not going to come down real hard on GMOs just because I feel like a lot of things are unanswered that way. So I'm not coming down so much hard on that. My issue with the GMO soy is that it doesn't really resemble kind of like its heirloom crop, right? Like its original food. So when I'm presenting these studies, I'm doing it based on people eating the foods. And a lot of times they're eating the foods in their traditional ways. So I can't like validate or endorse something where the amino acid sequence might be totally different because it's been so changed, like in its cultivation. So my issue with it is I want to eat the original food because that's what the research is mostly driven from.
You also mentioned olive oil and healthy nuts. Would you, can you talk a little bit more about that and how much someone should incorporate them in their diet?
Totally. And I just really, I think that slide fell out of here when I had so many slides. So olive oil, this is a study. It's called the Med study. And the Med study showed less breast cancer risk among olive oil consumers. Here's the catch, ladies, and if there's a gent, is that it wasn't really looking at cooked. Like most of those cultures are pouring it onto food. So like you made dinner and then you drizzle it on to like whatever you made, or you have a salad and you drizzle it on. So my preference is that my patients are eating raw extra virgin olive oil. Okay to saute with it, but I really rather it not be cooked at too high of a temp where you end up getting to what's called a smoking point. Because when you do that, then you change like some of the properties and you actually change some of the phytonutrients too. So I prefer raw extra virgin olive oil. And if you look at the Med study, it's about the equivalent of like 1 tablespoon twice a day.
Thank you. How about turmeric?
I use a lot of turmeric. I do use a lot of turmeric. I do.
What are some of the ways?
The situations I use it the most, joint pain. I use it a lot for joint pain. Fatty liver. I use it a lot for fatty liver. I use a lot of turmeric on people who have colitis. So I have, for example, I have a patient who had ulcerative colitis and the turmeric really helped her a lot. So even though she was a cancer patient, she was a survivor, but the ulcerative colitis was really damaging to her. So I worked with her a lot on gut health, and for her, like turmeric, glutamine, and a probiotic was like a miracle. So I use a lot for gut health. So liver, gut health, sometimes depression, actually. I have some patients that respond really well to turmeric with depression. So there's some situations where There'll be some traits that really ring true to me, like just overall achiness and pain with depression, that I'll use the turmeric too.
Thank you. And what about the supplement turkey tail and krill oil?
Yes, so turkey tail is the same thing as Coriolis. So remember that slide where it improved overall survival? Yes, I use a lot of turkey tail. That's the Coriolis. And then the krill oil I don't use it as much as fish oil, just because the cost, like you have to take a lot of krill oil to achieve the same milligrams as the fish oil, but there's some situations where krill oil is better. So krill oil is better. It can actually lower cholesterol a little bit better than regular fish oil, but again, you got to take enough. And there are some studies actually in some cognitive brain issues where the phospholipid element of krill oil is better. So if I have somebody with cognitive issues and they're like, hey, I have krill oil or I have fish oil, I'm like, oh, let's try the krill first. So some cognitive situations, I'll use krill, and some lipid issues if they're willing to take enough of it.
What about coffee consumption?
I like coffee consumption as long as a person can tolerate it. So coffee reduces dementia, it reduces liver cancer, it reduces risk of colon cancer recurrence. So those are all the benefits of coffee, okay? That's a lot. It's bad in a situation where somebody has got an HPA axis, hypothalamus, pituitary, adrenals, where they're taxed, they're like kind of like tired but wired. So if I have somebody fried, I'm pulling back on that coffee if I see them like that. And you know it because you sit with them and they'll tell you, like, I just feel so depleted, but I'm living on coffee and sugar. Well, that person, I don't care about the health benefits for liver and cancer. Like, they need to get off all that caffeine.
This is going to be the last question regarding diet. Talk about a little bit about alcohol. How much, you mentioned there is a correlation to recurrence and breast cancer. And a couple people here have mentioned enjoying a glass or two of wine. Can you talk a little bit more about the alcohol consumption?
Yeah, full disclosure. I hate that part. So, I'm the same way. Like, we're all in COVID and there's nothing to do. And I like a glass of wine too. And I hate feeling guilty about it. Same thing. I'm in that boat. So basically, and there have been this is the good news. There have been a lot of studies on this. Like, the UK did a great study on alcohol, breast cancer, and recurrence. And basically, once you were just at 2 drinks or less per week, it was so negligible that I feel very comfortable with that. So I tell people 2 drinks or less per week, a breast cancer survivor, especially kind of in like the hot zone. Okay. So if you look at the time, like if someone's like 7 years out and from a HER2 positive breast cancer, their chance of recurrence is very low at that point. Like, I'm not going to be as worried about it as if someone was like strongly estrogen driven, maybe 10 positive nodes. I'm like, alcohol, maybe not worth it, 2 drinks per week, So I think there's some individual circumstances, but overall, that's typically like the cutoff that I'll say.
Thank you very much. Read this question actually. The person explains having gained weight as a side effect, and it was explained to her that withholding the estrogen kills metabolism, similar to entry into menopause. What solutions do you see or have you seen to work to jumpstart the metabolism?
Yep. Weight bearing exercise. So remember how aerobic reduced recurrence? Weight bearing definitely is good for metabolism because lean muscle mass increases metabolic rate. So that's one thing. Number 2, doing that 13 hours between dinner and breakfast. Okay. Because that cuts out that late night eating. You can't do it because and it's not 13 hours where, you're eating late at night and not eating breakfast. It's 13 hours at night. I don't want people eating after dinner. Like, that's it. You're done. And then green tea, actually, since we talked a lot about that, has natural appetite suppressing effects and has a small metabolism enhancing benefit. So definitely that. But there are a lot of other things too, like, cinnamon helping with, belly fat. I use alpha lipoic acid. I mean, I have so many like tools in the toolbox depending on the scenario. But basic easy things would be the 13 hours at night. And then also make sure you do weight bearing exercise. And cutting out sugar. And please cut out sugar.
that was actually a question that came in when you said sugar. Talk a little bit more about that, because that just came in as a new question.
Well, there was always this thing like, sugar feeds cancer, but it wasn't really well vetted. Like, people didn't explain it properly. And there does seem to be in breast cancer, and not just breast, ovarian and a few other subtypes, and colon actually too, a stronger correlation between something called IGF-1, insulin growth factor 1, and potentially increasing recurrence. And when you have a high refined carbohydrate diet, which would include sugar, you spike your insulin, you'll increase IGF-1, increase hemoglobin A1C, and potentially you could increase recurrence. There are actually some vaccine trials right now for breast cancer. I've had 2 patients do it, where the vaccine was for IGF-1 receptor. Isn't that interesting? So like the vaccine was against that receptor that goes up when you eat sugar. And actually both of my 2 patients, only 2, but they're both doing well.
I'm going to do this last question here, just because I want to be mindful of everyone's time. What I'll do, Michelle, is I'll send you a couple of these questions that were outstanding, just to be mindful of people's time.
Totally.
And then what I'll do is I'll send it along with the evaluation and
totally.
Can you talk about so the person explains having joint pain from Latrazole. Is there a dietary change or supplement or physical activity you would recommend?
Exercise does decrease the pain. We know that there's a Yale study that showed you get about a 1/3 reduction if you just exercise. Okay, so that's weight bearing anaerobic if you're going to do that. Some will think, oh my gosh, I have pain, I can't exercise. But actually the opposite is true if you look at the literature. So that's the first thing. Second thing is I definitely have them follow an anti-inflammatory diet. So like no deep fried foods, no processed foods, like not eating out of a box or a can. You're eating real foods, like an anti-inflammatory diet. And then when that's not adequate enough, I'm using nutraceuticals that reduce inflammation. I'm using the turmerics, I'm using the omegas, I'm using enzyme blends and boswellia and anything I can do to help them tolerate their treatment so that their quality of life is good.
Thank you so much for your time today. Thank you, Tom, as well. For everyone who joined us this evening, we appreciate you being on this webinar, and we hope to see you next time.
Thanks, everyone.